Okay. Good evening, curious minds. A warm welcome to all the first timers and a big shout out to the patrons of Curious Minds community. I thank you all for your interest in science. Today we are discussing the science behind trauma. So I will start with the definition of trauma, the scientific explanation of how any traumatic experience changes our brain and nervous system. Then I will discuss the different treatment modalities and share some science backed tools and tips to deal with trauma. At the end, I will share some books for further reading. So, as always, I will start with the presentation and then the meetup will be open for questions and discussions. Before that, let me introduce myself. I am a cancer immunologist. I also write 2 newsletters which are free to subscribe. Do check out if interested. Recently, I've also started a science book club on Meetup. This month's book is Dr. Mate's The Myth of Normal Trauma, Illness, and Healing in a Toxic Culture. So it's very relevant to today's topic. So now let's get to the science of trauma. Excuse me. First, let's understand the meaning of the word trauma. Trauma actually comes from a Greek word which means wound. Trauma is a psyche wound that hardens your psychological you hardens you psychologically, that then interferes with your ability to grow and develop. So Jessica Stern shares her experience of trauma in her book by saying that some people's life seems to flow in a narrative. Mine had many stops and starts. That's what trauma does. It interrupts the plot. It just happens and then life goes on. No one prepares you for it. Trauma is not that happens to you, but what happens inside you as a result of what happens to you. According to Gabor Mate, he has expertise in trauma, addiction, and stress and childhood development. We will be talking a lot about his research and research of other expertise in trauma. So trauma actually does is it leaves a scar. It leaves a scar and imprint on your brain, nervous system, and immune system, which then interferes with the ability to grow and develop. And when this wound is actually raw, the wound of the trauma is actually open and it's raw, and it really hurts when someone touches that wound you sustained a long time ago and that has not healed, and you respond to it like, is this happening at present? So that scar, the wound, the scar on the wound is actually very hard and rigid, and it doesn't grow, and it stops your emotional development. So it's all the psychological definition of trauma, and now we will slowly go on and understand the physiology and the science behind it. So first of all, first differentiate between the trauma and stress. So all trauma is stressful, but not every stress is traumatic. So how we can differentiate between stress and trauma? Here's just an example of, right now there is no clear definition in the field. So this is the paper which is trying to describe it. So when somebody goes through this traumatic or stressful situation, so after a stressful response, body develops resilience, which is the ability to be exposed to a stressful experience again and to cope with it. But after traumatic experience, brain, body, and mind changes, and it is remembered in the body, and you don't have the ability to deal with that stress. So this is a distinction between trauma and stress after you have gone through that event. Okay, so what happens when a person's trauma is not healed? And is the saying, and there's a saying that time heals all wounds, but it's not true in that case. Studies have shown that time does not heal trauma. Time may make it less available to the memory, but time does not heal. It doesn't go away automatically. You need to put in the work for healing. It's up to you to find ways to achieve healing during the time that passes after experiencing a wound or trauma. So unhealed wounds stay dormant. And when someone touches that wound, it will show up its painful impact, and you will feel tormented all over again as the first time. And this condition is called post traumatic stress disorder. So trauma is not just an event, as I've mentioned again and again here, that it it takes place sometime in the past, but it also has the imprint left by that experience on our mind, body, and brain. This imprint has ongoing consequences for how the human organism manages to survive in the present. It changes not only how we think and what we think about, but also our very capacity to think. So most traumatic patients experience learned helplessness. What it means is it can be explained by this experiment which Seligman and Mayer did. This was done in 1960s. Now, ethics committee will not uh, give permission to do this experiment. So in this experiment, he did with dogs. So in two different situations, as you can see in this figure, there are two different situations. The first dog was bounded and was given shock. So in the first situation, the dog understood in the harness situation that there is no escape route, and the dog has to go through that shock. And in the second situation, the dog actually learned that there is a way to go out because it was not harnessed. Whenever the shock was there, the dog pressed that lever and could move away from that shock situation. But then in the second case, they in both the situations the dogs were not harnessed, but the dog which learned that there is no easy way to go out because in the earlier situation it was harnessed, this dog was free but was not going away. Like the dog learned that helplessness situation. The same thing happens with traumatic the people who have gone through that traumatic stress situation. So here it's like simply similarly read, these people, they will not experience different, they will not go to experiment new options, and they will just get stuck in the fear which they know. So the only way the dogs in the experiment were saved from shocks is when the experimenters, they pushed them away from the cages. So even the cage was open, the dogs were not able to go out. So that's the similar thing happens to traumatic people. So this is the first thing, learned helplessness. And the second, the other common phenomena with traumatized people is that they reenact trauma, a condition which is called repetition compulsion or repetitive compulsion, which it involves repeating physically or emotional painful situations that has happened in the past. So this is a way traumatized people do it in an unconscious attempt to get control over a painful situation, thinking that they eventually would lead to mastery and resolution. So this is an unconscious attempt of just getting through that situation, and again they will repeat uh, the same painful act, and this will just lead to further pain and self-hatred. For real change to take place, the body needs to learn that the danger has passed and to live in the reality of the present. These two behaviors can be understood when we learn about our brain. So Dr. Paul Conti explains that when logic and emotion comes head to head, emotion wins all the time. It's powerful enough, it will always win. So, to make sense of these repetition, compulsion behavior, and learned helplessness, and what Dr. Conti is explaining in the previous quote, we need to understand the triune model of brain. According to this model, our brain can be broadly categorized into three different brain structures. So, the first one is the reptilian brain, the oldest part of the brain. It was developed around 400 million years ago. It consists of the main structures found in the reptile's brain. So the brainstem and the cerebellum. This is the brainstem and the cerebellum. It controls our most basic functions such as our heart rate, body temperature, blood pressure, breathing, and balance. So these reptilian brains are reliable but tends to be somewhat rigid and compulsive. And then is our limbic brain, which is also called the emotional or the feeling brain. So this brain this developed around 250 million years ago, and the evolution and with the evolution of the first mammals. So it can record memories of behaviors that produced agreeable and disagreeable experiences. So it is responsible for what are called emotions in human beings. So the limbic brain is the seat of the beliefs and value judgments we develop, often unconsciously, that exert a strong influence on our behavior. So this limbic brain has six different structures as shown in this diagram. We will go to few of the important ones which are changed in the traumatic brains. Amygdala is one of them. And then the third structure is the neocortex. As the name suggests, neocortex means it is a recently developed brain, which is around 500,000 years old. And it gives us the mechanisms for self-control, planning, consciousness, rational thought, awareness, and language. And this actually differentiates us from other mammals because we have a very thick neocortex. Human Homo sapiens have a very thick neocortex, and this makes us the in the top of the mammalian lineage. So this is the newer brain, and this is actually developed in the adolescent age, and that's why you can imagine why teenagers act out as they do, because they don't have a very developed neocortex. So our, our limbic system, which is the emotion center, plays a dominant role, and emotions overrule the logic in case of repetition, compulsion, and learned helplessness. So the rational brain basically becomes impotent to talk to emotional brain out of its own reality. What I mean by this is, let's understand how the brain changes in the traumatic people. So in normal conditions, these responses, these all three brain structures are actually designed to help us survive in the difficult conditions. And they have done a good job of surviving us from this 500 million year old history. But in a person in a person who has gone through trauma, the brain changes. So the first region which changes is the limbic brain is very active, the emotional center is very active, and one of the region, which is the amygdala, is the one which is uh, very active. So amygdala is the almond shaped structure which is particularly placed in our emotional brain, and it determines whether a sound, image, or a body sensation is perceived as a threat or not. So without the prefrontal cortex deciding it, so without any logic, first is the emotional center which decides whether this particular situation, particular sound or image is threatening to us or not. And then this sensitivity of this amygdala is actually somewhat controlled by a neurotransmitter called serotonin. So in traumatic patients' brain, traumatic people's brain, this neurotransmitter serotonin is actually very low. And that's why they perceive everything with a high emotional state, with a high threat state. And the other region which is changed in the traumatic people is the Broca's region, which is significantly decreased. So Broca region is one which controls our speech center. So it is a speech center of the brain. So without the functioning Broca area, we will not be able to put words to our thoughts and feelings. So that's why most of the people who have gone through the trauma, they just remember the emotion, they just remember the pain, but they cannot express it. So this uh, researcher, Bessel Wender Koch, describes it as all trauma is pre-verbal. Trauma by nature drives us to the edge of comprehension, cutting us off from language based on common experience or an imaginable past. So this is the characteristic feature of a person who is going through trauma or has experienced trauma. So moreover, significant decrease this Broca's region, and the other region which gets activated is the Brodmann's area 19. This region is one which registers the images. So this is the visual cortex of the brain, and it will register the images. So under normal condition, under ordinary conditions, these raw images which are registered in this region are directly, they are sent to other brain areas which make meaning of this particular image. So one part of the brain is registering the images and the other part is making sense of it. But in case of traumatic trauma changed brain, this region is only capturing the image or the sound or the smell, and it's not diffusing it away or sending it away to make sense. So this is registered permanently in the brain structure. So that's why the images of post-trauma activate the right hemisphere of the brain and deactivates the left. So these are the few changes which happened, as I mentioned. Now, when I say that when a person is going through that traumatic experience again, the right hemisphere of the brain gets activated and the left gets deactivated. So we all know that left and right brain, left is the one which has the logic language and the right is the one which has the emotions or the sensory intuitive part of the brain brain region. So in case of the traumatic patient, they have this right region activation. So emotional brain is very active and the logical brain is down. So even the trauma has occurred in the past, the person cannot put the time in that place. So the person cannot put words to that and also cannot understand that this is not occurring in present. This has passed away. The person feels as if this whole thing is happening right now, and there is no logic. The logical brain and the visual cortex is dissociated. They cannot make sense of what is going on right now, and the person experiences the whole thing as if it is happening right now. So just few details about these two brain regions. So the right brain is the first to develop in the womb, and it carries the non-verbal communication between the mother and the infant. So the right is, as I mentioned, intuitive, emotional. It is visual, spatial, tactual. That means all that touch, sound, hearing, all the emotions is processed by the right brain. And the left half is actually the brain which carries the music of experience. Which makes the sense of that, whatever the right one has experienced. So the left and the right sides of the brain also process the imprints of the past in dramatically different ways. So the left will remember the facts and stats and the vocabulary of events. When we call on it to explain our experiences and put them in order. So the left one will, whenever we are recalling any memory from the past, the left will put that in order and will tell us when this particular thing has happened. And but in case of traumatic people, because of their left one is not working properly, is deactivated, they cannot put that memory into place. So now let's go further and understand how trauma changes the nervous system of a person. So after the trauma, the word is experienced with a different nervous system. What I mean by that is their stress response is very active. It's always hyperactive. We have a stress response, the freeze, fear, and this response, the stress response, when we have for our survival. But in case of trauma person, this stress response doesn't go back to that normal stage and it remains hyperactive. And the stress hormones spike very quickly if certain incidences happened, which will trigger that past memory unconsciously. Just a sound or smell or a image or certain contextual thing which happened, which is related to that past traumatic event, the person stress response will outburst, and it can come up as anger, it can come up as a freeze response, it can come up as a shutdown response, however the person is processing it at that moment. So this activated stress, the chronic stress response, actually then starts showing its effect onto different parts of the body. It will change, it will hamper your memory, your attention problems, irritability and sleep disorders. So this all thing will start occurring on surface after years of chronic stress response activation. And then the whole range of physical symptoms like fibromyalgia, this is the pain which a person can happen like with no cause of it, like you are not, you have not like got hurt or something, but you are having pain in certain area. Then your chronic fatigue, which has no explanation, you are eating well and everything, but because stress response is a very energy demanding process, and when it is always active in your system, you will always feel chronic fatigue. And then it also takes a toll on your immune system, because immune system is also always hyper alert, and when it is hyper alert, you can have in your mid age, or if you have experienced a traumatic experience, if you have in your childhood, then maybe in your mid age or your later older age, you will suddenly suffer from autoimmune disorder, and there is no explanation for it, like why autoimmune disorder is happening. The reason is because your immune system takes a toll when your body is in hyper alert state. When your stress response is hyper alert, your immune system gets activated, because everything in a system works in symphony. So if something is not working properly, the other system will take a toll because of that. And this happens if the trauma is not healed, the wound is not healed, this will starts happening. So now let's understand this whole thing, like what I mean by the stress response, or what is the science behind it. So in our body, we have this system in our brain which identifies danger. So here I will explain it as a cook and the smoke detector. This is from the book, The Body Keeps the Score. So in that book, it is very well explained, like so let's understand that danger is a normal part of our life, right? So we perceive outside world through our eyes, nose, ears, and skin. These sensations converge in the thalamus. Thalamus is the limbic brain, the emotional center. And these sensations are then passed on in two directions. So one is directly to the amygdala. Amygdala is the center which is perceiving something is dangerous or not. So this is the low road. And when it goes to the sensory cortex, where the meaning is put into that image, that's the high road. So it takes like milliseconds more to reach to the sensory cortex. So first you are understanding, you are just you are not making sense of that image. First you are getting you respond to that fear first. Like if you see a rope and somehow in the dark you think that it's a snake, so you will jump immediately, or you will just run away from there. But then you will switch on the light and you will see that it's a rope. It's not that. So your prefrontal cortex is making sense of that particular thing and telling you not to get stressed and not activate your stress response. When you feel that, your stress response will go down. But in that immediate situation, this false alarm activated your stress response. So this is what the cook and the smoke detector is. Cook is your amygdala and your smoke detector is your hypothalamus. So this is what how the brain is detecting stress. And then we have this HPA axis, which is hypothalamus pituitary adrenal axis. This is the axis which gets activated in the stress response. So the brain is giving the message to the body to get prepared for that stress response. So whenever you are feeling that stress or an anxiety, you will start seeing this sympathetic division of the autonomic nervous system getting activated. Autonomic means it's not in your control. It is just happening inside unconsciously in your body. All these changes are happening. So your pupils will dilate, your saliva will inhibit, airways will dilate, your heart rate will increase. All that the things are happening in your body without your conscious awareness of it. But yeah, you will feel that heart rate is getting activated without running or something. Just seeing you, we all have experienced that fear response. And your cortisol gets activated. So cortisol are the hormones which are released by the adrenal glands. So when your brain is telling you something is fearful, your autonomic nervous system gets activated. Then your adrenals will start releasing cortisol, and all this is happening inside the body. Now go back to the thing which I told you, that in traumatic patients, their stress response is always activated. So all the body is taking a toll, like every time this is being activated. So what we need to do is we need to activate the other system of the nervous system, which is the parasympathetic nervous system, which will overcome this sympathetic division. So, to conclude, in post-traumatic stress disorder, the critical balance between the amygdala, which is the smoke detector, and the prefrontal cortex, which is the watchtower, which is making sense, shifts radically, which makes it much harder to control emotions and impulses. So, neuroimaging studies, when a person goes through that MRI scan, reveals that highly emotional stress like intense fear, sadness, and anger all increases the activation of this subcortical brain region, which is the watchtower, involved in emotions, and significantly reduce the activity in various areas in the frontal lobe. So frontal lobe is the one which is making sense of things. So frontal lobe activity is decreased, and you are always feeling that every stress is major stress for your body, because you cannot make sense whether that particular rope is a snake or is just a rope. Just a hypothetical example. So every small stress is going back and reminding your body of that major traumatic stress which happened in your life at some point of time, and you experience that uh, like it is happening right now. So now we all must have understood now what is the science behind this trauma, what is happening to our brain, what is happening to our nervous system, and how our immune system is getting a toll. Now, what are the treatment approaches? So right now, like you must have understood, like if we want to get healed by this trauma, if we want to heal the wound, we need to work on all three different stages. We need to work on our mind, we need to work on our body, we need to work on our brain. So we need to engage everything to achieve proper healing. How we can do that? So there are three different steps of doing it. Number one is acknowledging the reality of your body in all its visceral dimensions. So, acknowledging reality is sensing, naming, identifying what is going on inside. It is the first step of recovery. Sometimes we go in the denial mode, we don't recognize, we just, body always gives you signs. So, you have to start recognizing it. First, this is the first step. So, Elvin Semrat says that the greatest source of our suffering are the lies we tell ourselves. People can never get better without knowing what they know and feeling what they feel. So, this is the first step. And the second step is learning to live in the present. So, enhancing the quality of day to day experience, start taking joy in small things. So, engaging the safety system of the brain. So, we have to remind our brain that things are safe, and the make logic of the things. To make logic, we have to first slow down our uh, smoke center or the watchtower. So how we can do this? The third is to reestablish ownership, which is self-leadership. So when a person has gone through a traumatic experience, the person loses control. It always seems like you don't have control over things, that learned helplessness thing, and you feel fear and shame because you are doing it. The first thing is you are not responsible for that trauma. The thing happened to you, not your role was there. So find ways to cope with feeling overwhelmed by the sensations and emotions associated with the past. So how we can do this? We can do something like limbic system therapy. So to efficiently deal with stress, a balance between the smoke detector and a watchtower should be restored. The only way to access this is through limbic system therapy. So, limbic system therapy is uh, two approaches, top down and bottom up. So, here, the whole idea is that there is a bi directional communication between body and mind. So this bidirectional connection between body and mind was not actually recognized by the Western world before, but now it is being recognized in major centers like MIT, Stanford, and they have different mindfulness programs, and they are using these meditation, mindfulness, MDSR kind of strategies to deal to for patients who are dealing with trauma. And there are many clinical research going on for this. The whole idea is that our brain actually responds to our emotions, right? As we know that there is an emotional center and there is a logical center. So emotional center is the one which rules, basically it is the one who takes control of things when the logical center is not working properly. So whenever there's a tug of war, there will be always emotional center winning. So have you ever experienced like someone if is laughing uh, like crazy, if you are not in the mood of laughing, you will start laughing with that person. This is because we have mirror neurons in our brain. So when we respond to other person's emotions, if a person if a person's face shows some danger or some stress, we will reflect that on ourselves. Either we will go away from that situation, or we will behave in the same way the other person is behaving with us. So this is how we mirror the expression of other person. So that's the common theory behind it, that there is a bidirectional communication. So if this thing is happening, we can take control of this understanding to treat ourselves, to do something about that, the disbalance which is happening in our system. So the top down approach is to strengthen the capacity of the watchtower to monitor your body sensation. So watchtower is our prefrontal cortex, which is making sense, which is actually looking inside. So we have to introspect. So we have to follow mindfulness, meditation, or yoga, which is shown to calm the body and activate the parasympathetic nervous system. So these are the two ways which you can do to get control of that feeling. The second is the bottom up approach, which is the recalibration of your autonomic nervous system. So you can do this by controlling your breath, movement, and touch. So what I mean by this is you can experience this by yourself. So whenever you're taking a deep breath, you are activating the sympathetic nervous system, and whenever you are exhaling, you are activating your parasympathetic nervous system. So the resulting, when you inhale, the resulting burst of adrenaline speeds up your heart. And when you exhale, you activate the parasympathetic, which slows down the heart. So as we breathe, we continuously speed up and slow down the heart. And because of that, the interval between two successive heartbeats, it's never precisely the same. And we can measure this interval. We can measure the interval of this heartbeat, and it is called the heart rate variability, or HRV in short. So this HRV, measuring the HRV can give you an idea whether your heart is getting that proper rest, and it will also tell you the flexibility of the system, how well you are able to deal with the stress. So good HRV is a sign that the brake and the accelerator in your arousal system are both functioning properly and in balance. And there are now many wearable devices which can give you HRV reading, and this is the first step to know whether your heart is working properly, whether your stress response is in control. So that's the first thing, HRV, which you can do. And as I told, that when we are inhaling, we are activating the sympathetic, and when we are exhaling, we are actually activating the parasympathetic. And the parasympathetic is one which you can easily remember as the rest and digest autonomic nervous system. So you have, if you are feeling stress, if you are feeling overwhelmed with the emotions, you can simply do the deep exhalation. There is this is called like the 5-minute psychological sigh, which is double inhale through the nose, followed by double inhale through the nose and followed by long exhale through the mouth. So these are the simple tips which can be followed to activate the rest and digest system in the body, and to slow down the heart, the racing heart, and to give that internal signal to the brain, to your emotional center, that things are fine. Because as I say, that there is a communication, bi-directional communication between your body and mind. If you are giving that signal to your body that things are fine in a way, because your heart is slow, because you are taking a deep inhale, you are giving this signal, because your heart is connected to your brain through that vagus nerve. And this indirect signaling will slow down the heart, slow down the brain function, brain stress response pathway. So the brain will give the function to the pituitary, and pituitary to the kidneys, not to activate the cortisol, not to activate the stress response. So indirectly everything will start working fine, but this takes time. This will not happen like in one session. And the second thing you can do is 5 minutes of cyclic hyperventilation. So this is deep inhale through nose, immediately following by deep exhale through the mouth, which can be done 25 to 30 times, and then fully exhaling until lungs are empty, and repeating the same thing. So these are very simple things which can be done, and you can see the results by yourself. The movement is one another thing. Like movement always activates the dopamine in your body, and dopamine is the motivational driver, and it then gives the signal that things are fine. It will activate the serotonin, and serotonin will then work with the amygdala to say that there is no danger. So in a way, you can work on these things. The third is the touch. So touch is the most elementary tool we have to calm down. So it is recommended that go for therapeutic massage or craniosacral therapy. Some people don't like the touch because it reminds them of some trauma. So for them, this is not recommended. But it is said that if you want to fully recover, you have to feel safe in your skin. So work with the HRV, work with the breathing, and then movement, and then maybe later leave the touch when you are feeling comfortable. So these are the few things which can be done. And then there is the importance of social relationship in the path of recovery. This is the polyvagal theory, which was actually given by Charles Darwin. but it's not like appreciated so well with his name. Um, but this theory tells that we have a vagal nerve which connects our organ. Like this vagus nerves is the longest nerve which connects the brain with the lungs, heart, stomach, and intestine. So the gut feeling, which we call, when we have that instinctive gut feeling, it is connected to your brain. And gut is actually also called a second brain, because it has all lot of nerve connections. So if you want to if you have to have the safe recovery, we need to have good social connections. And these social connections doesn't mean to have people around it. There should be reciprocity. So being truly heard and seen by the other people. So this is the other thing, social relationship. And then choose a professional therapist. Talk therapy is good to start with. And then there are a lot of pharmacological tools. But when when you are prescribed a drug to deal with the things, they are only dealing with the symptoms. They are not actually curing you. They are just curing you but not healing you. So to heal, you have to actually touch on that part which is changed. So you have to actually change your brain, how it is percepting things around. And you have to actually give that strong connection of your prefrontal cortex, which makes sense of things, and the emotional center, which is lost. This connection, this crosstalk is lost in case of trauma people. So uh, and then there is this EMDR, which is eye movement desensitization and reprocessing. It actually is for it, it it reduces the activation of the amygdala and the associated anxiety, and it reduces the amplitude of the threat reflex. So it's done with a professional. And then there are several behavioral therapies like prolonged exposure, cognitive behavior, and cognitive processing. I will not go into the details of these. But then to end with, there are some lifestyle and behavioral factors. Sleep is one. Get a good sleep, which will help, and deep social connections, as I mentioned. And then there are few studies which mention that saffron is a antidepressant. It has antidepressant effects, but a very large quantity you need for that effects. Then inositol at 18 gram. Several studies have shown this is not like FDA approved. These are like commonly available over the counter pills, but there are many studies going um, which are seeing connection of inositol 18 gram daily with the anti-anxiety or antidepressant as an antidepressant. So this is the end like here. But if you want to read further, these are the books you can go. So these three people, these three researchers are the pioneers in the field, and they have done like 20 plus work in the field of trauma. We will be discussing The Body Keeps the Score in April in our book club. And then in February this month only, we are discussing The Myth of Normal. But these people, these authors, they have a lot of online material. Like they have spoken into many conferences. And if you are not into reading, you can hear them, listen them. They are really eye-opening things you will know. So now I will end this talk and I open the conversation for discussion.
Yeah.
So you
Thank you,
can,
Dr. S.
thank you. You
I have
can,
a
yeah.
sorry, I have a question. For the EMDR, did you mention that I think it said in the slide that it's not good for childhood trauma? Can you go back to
Yeah.
that slide or?
Yeah.